Hi, I'm Dr. Minette Rarden, the founder of North Texas Kids Magazine and NorthTexasKids.com. Welcome to our YouTube channel. You can check out all the other videos and interviews. We try to bring you lots of great information, take you on some fun tours of different businesses, and I'm so excited. I'm here at Therapy 2000 at their corporate office just south of Dallas with Jerre, who's their founder, mastermind, wonderful, creative, physical therapist.
Wow,
who
thank
is
you.
building this great big company.
Thank you for that introduction.
Well, thank you so much for your time today. I'm excited to share with parents a little bit about Therapy 2000 because I think
Great.
the work that you guys do in the community is great. It's a huge issue for parents. We're here to talk about some of the reasons why you might need some of these therapies, physical, occupational, speech therapy, and how you guys address some of those issues. So can you give us kind of an overview of Therapy 2000, how long you've been here, what are some of the ways that you're helping people every day?
Absolutely. Therapy 2000 is a home health company. We provide physical, occupational, and speech therapy services to children with developmental delays and disabilities.
And what ages do you focus on?
Well, we serve 0 to 21.
Okay.
The vast majority of the kids that we see are under 6 years old.
Okay.
Almost
Wow.
80% of the
Oh,
kids that
wow.
we see.
And is that because after that point there's other services available? You find that most kids start to grow out of things at that age? What happens?
There's a number of reasons. Many of the kids that we see that we get at very young ages,
Mhm.
especially if they have milder delays, we see them for 6 months or 9 months, and then they reach the goals that they are going to reach, and they're doing just perfectly fine. Kids that have ongoing disabilities, we'll see them even at older ages, but we
Right.
won't see them for really long periods at a time.
Okay.
And so they just kind of circle in and out.
Okay, well that makes a lot of sense. So let's talk a little bit about some of the special programs that you do in addition
Okay.
to physical therapy, speech therapy, occupational therapy. A lot of people don't even know what those mean, but in addition to those, you guys have some really cool programs, especially around feeding and swallowing, which I know is a really hot topic right now for a lot of parents.
Very much so. Our speech therapy department has really taken the leads, I have to admit here, sitting here as a physical therapist myself. We have a number of specialty programs very much geared towards feeding and swallowing function. A lot of the kids that are referred to us have trouble eating by themselves.
Okay.
Either they aspirate on foods that they should be able to swallow and pieces of food go into the windpipe, which causes complications, or they just don't have the strength to eat by themselves. And these are often kids that we get directly out of NICUs.
Okay.
And they come home with
So
severe,
they start very young.
yeah, feeding, swallowing. We see them literally the day that they come home.
Okay.
And so our speech therapists have a number of programs that we implement. The one that's been the most eye-catching is a treatment called Vital Stim.
Okay.
And this is one where you have to get used to a little bit. The first time that you see this as a parent, it looks a little bit uncomfortable.
It does. It looks a little scary. You've got all these nodes. We did an article, I know, a couple of years ago in the magazine, and it does. It looks intimidating.
And we've had parents that said they see our little machine and they say, "Are you here to electrocute my child?" And trust me, that's not going to happen.
Right.
The Vital Stim, it's a very low dosage of electric current that does go through the electrodes that we put on the muscles that help with swallowing, and it's actually a strategy to strengthen those muscles, just like you might go to the gym and pump iron for a few hours or do machines. We actually have that ability to give a simulated workout through electric current, and it's a wonderful, wonderful strategy.
And are you seeing a huge response in terms of the advances that the children are able to make?
Yes, absolutely. The protocol that we use has kids receiving this usually for about 6 or 8 weeks, and it's absolutely astonishing.
Well, it's not a very long period of time when you think of something as serious as a feeding and swallowing challenge.
Agree. And it tends to be very effective. Kids are able to eat different types of food than they used to be, 4 different textures.
Right.
They learn to swallow without the food going the wrong way. It's a great therapy. And
Well,
we're really
I can
proud to
only
offer it.
imagine the fear that a parent might have when their child is having feeding and swallowing challenges.
Very much so. Mealtime is such an important social time, especially with a young child, and if the child isn't able to eat by themselves, it ends up affecting the entire family.
Sure, that makes sense. That makes a lot of sense. I know in addition to the Vital Stim program and focusing on feeding and swallowing, you guys cover a whole host of developmental issues for children. As a parent, when would I call you? How do I get a referral? What do I, as a parent, especially as a brand new parent, you have so much fear, and every time your child looks a little bit different from their peers, you start to worry.
Right.
And sometimes your doctor doesn't corroborate that, and parents need other resources. What can I do as a parent?
Well, the most likely way that you'll end up with us is hopefully you have a pediatrician who you're collaborating with and who you will share, my child's not walking, the kids around him or her are, my child's not sitting up yet, and it's well past 9 months, what do you think is going on? Parents can definitely come to our website. We have some tools there that show developmental charts and things like that, and you can always just take a look at that just to kind of orient yourself.
And the website
is T as in therapy, 2000.com.
It's so easy to remember. the letter T, 2000.com.
Right. And so hopefully, if your physician seems to be skeptical about it, give us a call, describe what's going on. We definitely cannot diagnose over the phone, but there's plenty of people here who are very happy to be kind of a sounding board. And then you'd probably go back to your physician and say, look, I've talked to some professionals, I just want you to write a referral. I just want to have my child tested. And then we'll come out and we'll do a full battery of developmental tests, and those will show us where your child is as compared to typically developing peers.
And all of your programs, you're completely home-based. You send your therapists out into the family's home.
Family's home. Sometimes we'll end up seeing the child in daycare, kind of see, depends on what happens best, what works best for the family.
Well, that's great flexibility, especially for working parents. It's one of the biggest challenges as a working parent is getting all of those needs met for your kids.
So.
Well, let's talk about some of the other resources that are on your website. Again, it's T2000.com. I know you guys have locations all over the place. You have articles on there. Why would I go to your website? Oh,
you would definitely want to go just because we have great videos there, great success stories, patient testimony, and lots of research. Research also and resources, links to other organizations, and again, developmental charts to kind of orient yourself to how your child is developing.
And when I sit there and I read this developmental milestone list and I think my child isn't meeting them, a list is just a guideline, it's certainly not a hard and fast rule. What are some other things that I might think about once I've read that list of developmental milestones? What should I look for? Are there other visual cues or triggers?
Absolutely. The ideal case scenario is if you have peers around your child that are roughly the same age, and that you can just observe them play and see that your child you might see other kids handling small objects without any trouble, and your child seems to have a hard time holding a pen or holding something of that size. And so that's cluing you in, well, that's strange, why are all of his peers doing this and my child is not doing this?
And I assume that's more than one peer, because obviously you can have two kids side by side, and one is well advanced and one is normal, and it makes the normal one feel like there's something wrong when there's not. So when you say peers, in a group situation is what you're talking about.
Definitely. Nieces, nephews, cousins. Daycare is a great way to compare. And oftentimes this is where your parents, as a parent, grandparents can be a great resource. They usually put their finger.
They have an objective sort of third opinion they're seeing from outside looking in. That's a great idea.
Grandparents often have a really good handle on this.
Wonderful. Any last tips, words of advice? What is the most common question that you hear from parents?
It kind of depends on what kind of a child. For me as a physical therapist, the question that I always get is, and especially for a child that's more involved, will my child learn to walk? For the speech therapy, for a child to learn to feed and eat by itself independently, those are huge. We're often asked to predict the future, and luckily we have some tools.
Do you have a crystal ball on your desk?
Not so much. Luckily nowadays we have a lot of research that gives us a good opportunity to give somewhat of an outlook.
Great. Well, Jerre, thank you so much for your time today. I highly recommend that you give Therapy 2000 a call. Just ask questions. They're a great resource, and I know you have a main phone number. Even though you have locations all over the Dallas-Fort Worth Metroplex, you just opened in San Antonio.
Yes, we did.
And you're in East Texas as well?
East Texas. We're in Tyler now.
And so what's the main phone number that people can
It's
call?
214-467-9787.
Or go to their website. They have all the locations listed. Again, it's T2000.com. Jerre, thanks so much. It's always a pleasure to see you.
Thanks for coming by.
Thanks so much.